Dr. Klingensmith, I saw a couple of articles, one of them with Dr. Frank Lewis about changes in general surgery training. Can you tell us a bit about the main points of those articles?
Yeah, there's been a lot of sort of anecdotal observations that Dr. Lewis and I sort of coalesced into an article. It was also actually part of a panel presentation that we were fortunate to do at the American Surgical Association several years ago that basically talked about the fact that there's been some changes in technology that have changed the operative mix that our patients experience. It used to be that there was open biliary surgery. It used to be that we did portal vein surgery. We don't do that anymore. We don't do much gastric surgery with the exception of bariatric. So those pressures, as well as actually a decline in the need for trauma laparotomies. I remember as a resident myself, the way I learned to open and close an abdomen was on the trauma service. And more, because of our ability to image injuries preoperatively, we often don't even take those folks to the OR, or we manage them with, endoscopic means or endovascular means, or
just watching them in the ICU.
Right. So there's just less that our residents do in some cases. Layered on top of that are changes in the duty hour restrictions. And if you do sort of a back of the napkin calculation, you realize that not only have residents lost anywhere from 10 to 20% of time in the hospital because of the duty hour restrictions, but further, with the time they've lost actually isn't the 9 to 5 or the 7 to 7 daytime work. It's really the nights and weekends. And I don't know about your experience, but when I was a resident, the most independence I had and the most independent thought I was expected to exert was during those middle of the night codes and cases that were crashing that I had to get started in the OR before the attending could get there from home and so forth. Those experiences too, just by sheer number, are fewer for our residents now. So those articles that you mentioned were really just a description of some of the changes, and we're now working towards some potential solutions. There's lots of talk nationally about where we should go with some residency restructuring or residency redesign.
Right, great. Thanks a lot. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.